As the first doses of the COVID vaccine are being rolled out, mental health experts are warning we still have a very long road ahead. Professor Patrick McGorry, a leading psychiatrist in youth mental health and the 2010 Australian of the Year, he warns the mental health consequences of the lockdowns will be like a second wave of the epidemic. I spoke to Professor Patrick McGorry earlier and asked him to give us a sense of the scale of the problem.
It's been called the shadow pandemic. The Economist magazine actually coined that term, not just in Australia but around the world. The mental health impacts of COVID and not just lockdowns and all the restrictions that people have been labouring under, and not just the trauma and then the fear associated with the pandemic, but the economic effects are the things in the modelling which really worry us and worried us last year in terms of what we were going to be dealing with. And we thought we'd see a rise in maybe 30% of need for care in mental illness, and we knew our system wasn't ready to cope with it anyway. So it has been a big concern. The fact that the economy in Australia is actually recovering faster is a very positive sign in terms of reducing that impact, but we're still seeing surges of people coming into services, trying to get into services which are really overwhelmed. So we need action, and the government's done a pretty good job so far, but we need to do more.
Anecdotally, we saw the Victorian lockdown, and off the back of the second wave and the very lengthy lockdown last year, it was seen almost as the straw that breaks the camel's back for many people. Did you see that in Melbourne and Victoria? Yeah,
we definitely saw that. I'd break it up in probably 2 or 3 areas. The first is the morale issue, the public morale, which obviously, leaders have to manage that very carefully. They need to be hopeful and positive and also manage the situation, and that keeps people's morale going, like in wartime. It's been a well-studied phenomenon. Second thing then is a loss of well-being that people feel. They can't do the normal things that make life worth living. They can't go out for dinner, they can't play sport, they can't even watch sport. Things like that are reduced, music venues, So the loss of well-being is a second thing. And then the third thing which we can measure is the increase in people needing professional help for mental illness and increasing levels of mental ill health, and we saw that too.
And so when you look at the situation, the balance, from someone who is not an expert, but looking at this and the health professionals at various state jurisdictions, sometimes it looks like the balance is not there between the COVID response and factoring in the other health response, i.e. the shadow pandemic, as you put it. It just seems like it hasn't been anywhere near the priority it should have been.
Yeah, I don't know. I was discussing that with the Prime Minister this morning. I think that Australia is one of the few countries which did actually prioritise mental health care, both state and federal, alongside the pandemic. And maybe they could have done more. I mean, we always think that in mental health that more needs to be done. But compared to other countries, we've done well. We've done obviously very well in managing the pandemic, and we should all be grateful. And the fact that the pandemic didn't devastate Australia has been very good for mental health too.
Yeah, I guess so. And it does have that flow-on effect that we've been a world leader on that front. For Pat McGorry, thank you for your insights as always. Appreciate it.
Thank you, Kieran.